Hey, you, stop scrolling. Do you know that you can get cancer from oral sex? Let's dive into it. Here are the 4 dangers of oral sex. There are 4 main dangers of oral sex. The first danger is sexually transmitted infections. Sexually transmitted infections can be transmitted during oral sex. Although they say, oh, oral sex is pleasurable and all that, it doesn't come without its dangers. Sexually transmitted infections can be transmitted during oral sex. You have viruses like HIV virus, which can be transmitted during oral sex. Hepatitis A, B, and C virus, which can be transmitted during oral sex. Herpes simplex virus and human papilloma virus. These viruses can be transmitted during oral sex. And then you have bacterial infections like gonorrhea, syphilis, and chlamydia, which can be transmitted during oral sex. The number 2 danger of oral sex is cancer. This is a long-term complication of oral sex and is usually in the throat, in the mouth, and in the liver. How does this come about? How do you get cancer from oral sex? Remember, I mentioned the sexually transmitted infections. If you have any of these infections, like human papilloma virus, the dangerous strain can cause you to have cancer of the throat. HSV virus can also cause you to have cancer of the mouth and throat. And then hepatitis B and C virus can cause you to have liver cancer in the long term. Then the number 3 danger of oral sex is injuries or trauma. Injuries or trauma can result from using the teeth to perform the oral sex or being very rough during the oral sex. Then number 4 danger is allergic reactions. Allergic reactions can occur during oral sex. You can have, in rare cases, you can have allergic reactions to the sperm or to the vaginal fluid. And then you can also have allergic reactions if you use condoms to perform oral sex, when you react to the latex from the condom or from the substance used to make the condom. Now, how do we reduce the risk of getting oral sex? The dangers of oral sex. Number 1, you should use protection. Protection like condoms and dental dams are very important in reducing the risk of the dangers of oral sex. It protects your mouth, it protects your genital area if it's used in the genital area or in the mouth. Number 2, another way to reduce the risk of the dangers of oral sex is to avoid performing oral sex when you have cuts or sores or when you are bleeding from the mouth. Number 3 is to get vaccinated. Get vaccinated against these viruses and these bacteria that cause dangers in oral sex. There are vaccines for human papilloma virus, there are vaccines for hepatitis B, and there are vaccines for hepatitis B and C. So get vaccinated, and it should reduce the risk of having any of the dangers of oral sex. And number 4 is to limit the number of partners that you have. If you have one partner, stay faithful to that partner to reduce the risk of getting any of the dangers of oral sex. Thank you very much.